Ideally, don't go to work. Advise your employer that you're gonna stay home in quarantine. Ideally, it's 14 days from the time where you were in contact with someone. Someone that is young, that doesn't have any healthcare problems, that is super active, or just in general is in good health, is not really a risk of getting the illness or of death or of getting a severe form of the coronavirus. This said, there was one case of a healthcare provider that was that did die, unfortunately, and he or she was young. He was around 30 or 40 years old, so it could happen. It's an extremely rare case, but usually if you're young, it's like getting the flu. I could pass through it, and a bunch of people do pass through it also. What's the treatment? So if you have it, you go seek a doctor and everything. There's no real treatment currently. So what they do, it's called symptomatic relief. So they're gonna help the symptoms. So if you have a fever, they're gonna take Tylenol, Advils, support treatment, so cortisone or puffers or anything to help you breathe if you have difficulty breathing. So really helping your symptoms or help you feel better. In terms of healing or antiviral medication, they're studying, they're doing some research on that at the moment. There's a potential vaccine, but vaccines take a lot of time, so they have to test it. There's a bunch of steps before getting there, and that's expected by 2021. Also, antibiotics won't work if it's a coronavirus. So it's a virus. Antibiotics treats bacterial infections, so it won't work for the coronavirus. This said, if you go to a healthcare facility because you have an infection, they may give you antibiotics initially, just during the time that they're trying to figure out what's the real cause of a pneumonia or your symptoms, just to make sure you don't get worse. How to prevent. So this is really maybe the most important part of the whole Facebook Live and what I want people to remember, because this is valid for the coronavirus, the COVID-19, but it's also valid for any infectious diseases that could be transmitted through droplets. So wash your hands. Seems really simple, but a lot of people don't do it and don't do it appropriately. You should wash your hands for at least 20 seconds and you should really count. So it's not just a 2-second thing. Wash your hands appropriately with water and soap. Use alcohol. You could use, there's a lot of alcohol for the hands that you could use. Also, it's a minimum of 60% to be effective. Cover your mouth and nose when you cough or sneeze. So when you cough, it's really in your elbow or in your shoulders. If you cough in your hands, you should wash your hands after, because all of everything's gonna be on your hands and then you're at risk of transmitting it. So if you cough in a tissue even, you should go through that tissue. So you don't cough in a tissue, use it, put it back in your pot. No, don't do that. So you throw it away. It's a disposable tissue, it's for one-time use. And so it's super important to really have that respect towards others whenever you're sick, to really know how to cough, clean your hands, and just protect yourself and the others also. If you're sick, stay home. And this is including if you have influenza, the flu or whatever, stay home, because or else you're gonna infect your whole environment if ever you go. You don't really see the viruses, we don't see the bacteria, we don't see all those microorganisms. So it's really hard to know, oh, like I'm catching it or not. You're not gonna know. So it's important to be aware of those meaty microorganisms that are all over all over basically. Avoid crowds if you can. Ideally stay away at crowds where there's a potential risk. Either if you have it, especially stay away, and if there's a risk, stay away as well. So it's minimum of 2 meters that I would recommend. It's between 1 and 2 again, that the recommendation is not super clear. So always take more precautions. If your symptoms are more severe, including breathing, like trouble breathing, seek medical help. And again, always tell them about your travel history, super important. Some diseases, like now we're talking about COVID, but some diseases, including malaria and others, could take weeks, months to actually evolve within your system. So it's super important to tell your healthcare providers if you've traveled and where you've traveled in the previous weeks, months, and even years sometimes. What about the mask? So wearing mask, at this point, everyone in China is kind of wearing a mask. This is what we're seeing in the pictures. It's what we're seeing a bit everywhere in the news. And it's okay because people don't really know if some people don't know if they have it, or they don't know if that's what it is. And if you're coughing, it's more of a preventive measures for everyone, just to really reduce the spread. At this point here, for example, in Canada or even the US, it's not recommended to wear a mask unless you work in a healthcare facility. And there's different types of masks. I'll speak about the surgical mask and the N95 mask. So it's different. Surgical masks usually are worn by people that are sick. So if I'm sick, I'm coughing, I have the flu, or even I have the COVID-19, I'll wear a mask to protect people around me. Someone that does not have the virus or doesn't have any symptoms of infection and wears the mask, it does not protect at all. So it's kind of useless unless you're really working close with someone. But even then, there's no proof that the viruses don't cross or don't get into your system. Now, it could help like prevent touching your nose or touching your mouth, or if you touch something and you're not sure, it's kind of a source of protection. If you want to wear it for that, like there's no contraindications or anything, but just in terms, it shouldn't give you a false protective feeling, which like it doesn't mean that if you're wearing a mask, you start coughing throughout the mask. This is wrong. Even if you're coughing, you should still cough in your elbow and in your shoulder, and still wash your hands after as well. And the mask's also something maybe that people are unaware of. It's a single use, so it's not something you're gonna wear for a week or anything. It's usually like, even if we go, for example, in a healthcare facility, if I go in a patient's room, I'm gonna wear the mask and take it off when I leave. So it's really a one-time, single-use, disposable mask. And make sure you dispose it in a proper area to not infect other people also. If you're in China and you don't really know what to do and how to prevent, there's a couple of things. So avoid markets, make sure you eat food that are well cooked, and wash your hands as much as you can whenever you're in contact with anything. Keep updates, so really stay updated with what's happening in the country or what's happening with the government recommendations and all that. There's this recommendation, there's no huge proof, and again, the coronavirus COVID is not an airborne disease, so usually in airplanes it should be fine. It is fine, but you could also put like the ventilator just in front of your face, and kind of gives a small, how do you say it? It kind of like puts away or has kind of a filter for any viruses or bacteria. And again, it's mostly for airborne, for example, mostly for influenza. You could do that for that. The data on this is really not, it was said from some healthcare providers that recommended this, but it's really not evidence-based or anything. It's just a suggestion if you want to do extra precautions. So if you're traveling, can you travel? Can you go anywhere? Should you stop traveling everywhere and just stay home? The WHO, so World Health Organization, mentioned that it was a public health emergency, so that this case is a public health emergency of international concerns. And why did they do that? And it's mostly to really make sure people are aware, also because people don't, it's very hard to impose or to tell people, hey, you should wash your hands because you could infect someone else. There's a lot of kind of regulations that they have to implement, or advisories like that, and it's mostly to protect countries that don't have the infrastructure. Like if you are infected here in Canada, in the US, or in countries like Europe even, they have the infrastructure, we have the infrastructure, the healthcare providers, the tools, the medication to treat you appropriately, to make sure you have the best care. Now, if this happens in Africa or in a third world country, you might not get out of it the same way, because they don't have the infrastructure, they don't have the tools, they don't have the medication, etc., etc. So this is mostly why they said that, and we wouldn't want this infection to get to these countries, because it might be detrimental, it might be sad, and we don't want that. So that's why they really created that big thing. So should you stop traveling? No. Canada's recommendation is avoid non-essential travels to China. So if you can avoid it, just avoid it. If you could do your Skype meeting for a business trip instead of being in person, just do it. And avoid any travels in Hubei. Anyways, you might not be able to enter the country or even come back. So those are things you have to consider, like, okay, you really want to go? Well, there's going to be consequences throughout your journey regarding this. So stay up to date. There's a lot of protective measures if ever you have to travel to these places or places where there has been COVID cases. And you could always stay in contact with the government authorities, your government authority. There's a bunch of phone numbers and everything. If you go on the website, there's really a line, and usually they're good to answer you. Insurance, that's another point. So make sure you're covered. If ever you traveled anywhere or an area at risk, if you get an infection from COVID-19, you may not be covered. They may not pay your repatriation. As I said, I'm quoting, so many travel insurance plans exclude coverage for losses caused directly or indirectly by epidemics, which is the case now. The WHO has declared this, and the Center for Disease Control and Prevention, so CDC, recognized the coronavirus as an epidemic. So in that case, if you're traveling to China or these places and you get that, you may not be able to get repatriated. So it's important to choose or question appropriately. And make sure also that your flights and like the airlines are still accurate and it's still on. Travel protection plans generally exclude, I'm quoting again, losses caused by events that were known or foreseeable at the time the plan is purchased. So it's another clause of insurance that you may not know about, but they may cause you a lot of problems if something happens. There are policies that limit themselves to covering health conditions that were not known, so no pre-existing conditions at the time of travel when it was booked. So it's really something that you should be aware of before you travel, and just make sure you have the right coverage for where you're going. Another question that was brought up, is it transmittable via objects? So there's a lot of stuff that come from China, made in China. It's still unsure. What has been said now is that it may live up to 30 minutes on an object, but it's still not. It's still not. It's like a real data. It's a preliminary data, and you may clean it. So basically, like by the time it comes from China or from anywhere else, it may be dead at that point if you live in Canada or US or in the Americas. But if you suspect something, you could always just clean the package with alcohol, again 60%, and disinfect the package before you open it or touch it, or wash your hands after you touch it as well, just to make sure you're not transmitting it. Because you may touch it, you don't get it when it penetrates the skin, but we're so used to touching our face, our eyes. It's even transmittable through the eyes also. So if you touch your eyes, you're just scratching and you touch someone, it could be transmitted to that, but sometimes we're unaware of what we do. So this is why we just have to be more aware, and this is what the news and all these organizations are trying to share and to vehiculate. So again, you're a vector, you could get it. So make sure you take the precautions, but also protect anyone that could get it. That you could be next to someone that is immunosuppressed and really just went through chemotherapy, and you could literally kill the person just because you were close and you weren't aware or weren't doing any preventive measures. So it's important to do that just out of respect and out of for this world, just to be able to slow down that epidemic. There's a lot of consequences. I wanted to really slide something on the economics. And why it's important also because even on the medication standpoint, for example, in America, there are medications that we import from different countries, including these places from the world. So if these places are closed, there's no importation. It could impact also our supplies for our own people. So it's not a money thing. It's not about like the businesses or investors, but it's more about the impact of what it could do in different industries that could be important. It's a lot of experts are saying that it could be maybe a bit worse than SARS. SARS back in 2003 caused only a 1 percentage point reduction. So it really depends on the industries again. So obviously the travel industry is impacted, especially everything going to China. The China tourism has been really changed completely, and that may take a bit of time, but sometimes it can last 3 months, sometimes it can last a year. We're still not sure how long this coronavirus is going to be around. And that's pretty much it up to now. So there's a bunch of stuff also in the UK. There's government guidance. There's a lot of countries. Every country has their own. So depending on where you are in the world, you should consult your health, global health or country health advisory to know really what to do. You could always send us an email. We'll be more than happy to reply if you're looking for questions. If you have any questions or concerns regarding what's happening in the world, just let us know. I hope you enjoyed this. Don't hesitate, again, share your comments or anything else. Thank you so much.